Hello and welcome to your YouTube channel, My Expert Doctor. I am Dr. Shalini Singh Salunke, your consultant physician. First of all, I'm extremely sorry for not being regular with my videos for a couple of weeks because I was not feeling well. But now I'm completely okay and you will not miss your regular dose of health tips that I promise. So today, let's start with today's topic, that is hypothyroidism. It is one of the most requested topic for last couple of weeks. Before understanding hypothyroidism, you must understand what is thyroid. So thyroid is a glandular structure present in middle of the neck in the inner side. This particular glandular structure is responsible for releasing two hormones, that is T3 and T4. Function of these two hormones is to regulate metabolism in your body. Now, the secretion of these two hormones is regulated by pituitary gland, which release TSH, thyroid stimulating hormone, for regulation of secretion of T3, T4 hormones from thyroid. That means when T3, T4 is less in amount in blood, that condition would be called hypothyroidism. So let's start with the causes of hypothyroidism. Number one, iodine deficiency. As we all know, iodine is important element required for the formation of T3, T4 hormone. So if that is deficient in your body, obviously T3, T4 hormone will also be less in amount. Number two, familial, that is hereditary. If your mother, father, grandmother, grandfather or their parents, any of the siblings have hypothyroidism, that could be one of the cause for you to get hypothyroidism. Number three, stress, any kind of stress, physical, mental, if it is persisting for a long time, may lead to hypothyroidism. Number four, pregnancy. Number five, anti-thyroid medicines. If you are consuming medicines like lithium, amiodarone, which are known to cause reduction in formation or secretion of thyroid hormones, that can also lead to hypothyroidism. Number six, thyroid surgery. If you have undergone any kind of surgery in your thyroid region in the past, that can lead to hypothyroidism. Number seven, after radiation, which you may receive because of chemotherapy or any of the reasons. If you have received radiation on your neck region or upper chest region, you may develop hypothyroidism. Number eight is autoimmune condition like Hashimoto thyroiditis. That is when your own immunity is acting against or trying to kill your thyroid gland. Number nine, thyroiditis, which is because of viral or other infection or of other reason. Number 10 is over-treatment of hyperthyroidism. That is a condition where thyroid levels are more. So if you are giving more treatment for that, trying to suppress more of your thyroid action, you may develop hypothyroidism. Now let's see who are at risk of developing hypothyroidism. Number one, women. Any age group of women, either in the pubertal age or in pregnancy stage or after pregnancy. That is, you can say from 15 roughly to 49, 50, females are at a higher risk of developing hypothyroidism. Number two, age more than 60, irrespective of male or female gender. Number three, family history. Number four, other autoimmune disease like type 1 diabetes or celiac disease. If you have any other autoimmune disease, you may have higher risk of developing hypothyroidism. Number five, received radiation to neck or upper chest region. Number six, if there is a history of thyroid surgery in the past. Number seven, pregnancy. And number eight, delivery of baby within past 6 months. Now let's quickly see what are the symptoms of hypothyroidism which you must be aware of. If you see any of these 4 or 5 symptoms, you must contact your doctor and take your thyroid tests. Number one is fatigue. Number two, increased sensitivity to cold. Number three, constipation. Number four, dry skin, dry nails, dry hair. Number five, weight gain. Number six, puffy face. Number seven, muscle weakness and pain. Number eight, hoarseness of voice, your voice being heavy. Number nine, sudden elevated blood cholesterol level. Number 10, muscle pain, tenderness and stiffness. Number 11, swelling, pain, stiffness in joints. Number 12, your menstrual periods may become irregular or heavier than normal. Number 13, thinning of hair with increased hair fall. Number 14, depression. 15th, impaired memory, or which we call brain fogging. You'll find difficult to focus on one thing, concentrate on your activities or your household chores or your work anywhere or your studies. Number 16, numbness and tingling in hands. Number 17, decreased sexual interest. Number 18, enlarged thyroid glands. Now, if you have developed any of these symptoms and unfortunately you have decided not to take medicine or not to go to a doctor, let me tell you what are the complications of hypothyroidism. What may go wrong in your body, extremely wrong, if you will not take this disorder seriously. Number 1, goitre. It will be a swelling in the neck region which will look ugly. It may develop a kind of soreness whenever you will deglute anything or you will eat or swallow anything. It will be a painful swelling. Number 2, heart problems. You may develop some kind of rhythm problem, structural problem, other kinds of issues. Number 3, mental health issues like depression, anxiety, and other things. Number 4, peripheral neuropathy. The nerves of your hands, your legs may go wrong or haywire. Number 5, you may develop infertility. You will find it difficult to conceive. Number 6, birth defects. If you are pregnant and you are hypothyroid, there are pretty much high chances that your baby will develop some defects at birth or will have some problem with the brain development. So you must be very much aware of your thyroid levels and take it seriously, especially if you are pregnant. Number 7 is myxedema. It's a life-threatening situation. You may become extremely cold, your heart rate may go low, you will collapse immediately. Myxedema will not give you time to recover from your state. It's the extreme part of hypothyroidism, so make sure you never reach to that extent. Number 8 is severe muscle weakness and muscle loss. So these are all very grave complications of hypothyroidism if you're not getting treated properly. So any of the symptoms of hypothyroidism, first thing you should do is go get a consultation from a doctor. Also, do your thyroid level test if you are having any susceptibility or any suspicion. So in today's video, we have understood what is hypothyroidism, what are the causes of hypothyroidism, who are at risk, and how will you identify the symptoms of hypothyroidism in you or your family member. In the coming video, we will be discussing about the treatment of hypothyroidism, do's and don'ts regarding or related to your diet or exercise, certain kind of asana or yogasana which are useful during hypothyroidism. So all this we will discuss in the coming video, in the next video. Till then, stay safe, stay happy at your place.